If you have symptoms, stay home, isolate from others, and contact your healthcare provider for information about testing. COVID-19 diagnostic testing, which is testing to determine if you're actively sick with COVID-19, is becoming more widely available and is an important part of controlling the spread. We want you to get tested because knowing for sure helps people make good decisions to protect others. Disease investigation is a public health strategy to limit the spread of infectious disease. Investigating where and how people could have been exposed to COVID-19 is important to slow the spread in our community. This is called case and contact investigation work. You may hear it referred to as contact tracing. This is the regular work of public health. We do it for all notifiable conditions. We interview all people who have positive test results. This is the way we educate people who have COVID-19 infection so they can isolate themselves and take other measures to prevent the spread of infection. This includes guidance to return to work or school. We're generally able to do this on the same day we are notified of positive results. Contact tracing starts with an interview, generally on the phone, and public health staff work with a patient to help them recall everyone with whom they've had close contact during the time they may have been infectious. Then we do contact investigation or interviews. It's very important to talk with individuals who may have been exposed to a person during their infectious period, assess their risk, and educate them and provide guidance on how to prevent further spread of COVID-19. The ability to do extensive case investigations is one of the key functions public health will perform as we begin to dial back protective measures. Contact investigation is not used to punish, shame, or provide enforcement on anyone. It is an important step to stopping the spread of COVID-19. Antibody test results may help identify if you were previously exposed to the virus that causes COVID-19 and can check whether or not your body has produced antibodies. Antibodies typically suggest protective immunity after you've been recovered or been exposed to COVID-19. However, evidence is still being collected to determine if these antibodies actually provide immunity against the virus that causes COVID-19 infection. We are continuing to monitor the emerging science of antibody testing with hope and caution. Right now, antibody testing is mainly used in studies to determine how much of the population has been exposed to COVID-19. There is not enough evidence at this time to suggest that people who have these antibodies are protected against future COVID-19 infection. Don't change your behavior based on an antibody test. Antibody testing and studies are helpful in learning more about the COVID-19 virus, but these tests are not yet a reliable way to check for long-term immunity. While antibody testing holds a lot of potential, it doesn't give us the kind of reliable information we need, at least so far. More work is needed on this kind of testing in the coming weeks and months.